A very good afternoon to all of you. Respected Sister Principal, Dr. Sister Beena Jose, Reverend Father Thomas Varakala, Counselor of Social Apostolate, Devmata Province, Thrissur, Associates and members of Kuriakose Elias Service Society, Thrissur, Dr. Sunu Siriak, Assistant Professor, Department of Medical Oncology and Hematology, Vimala Institute of Medical Sciences, Thrissur, Dr. Thomas Ruby Mariamma, Head, Department of Home Science, Vimala College, faculty members, students, participants and organizers of this session. Myself, Ms. Urmila Vijayan, faculty, Department of Home Science, wishes all of you a very warm welcome to the webinar arranged as a part of the Breast Cancer Awareness Month. The session is organized by the Department of Home Science, Vimala College, in association with the Kuriakose Elias Service Society, Thrissur. We begin today's session by remembering the blessings of the God Almighty. I invite Ms. Kavya for the prayer. Now I would like to invite Dr. Thomas Ruby Mariamma, Head Department of Home Science, to deliver the welcome address. Please, Madam.
Our most respected Principal, Dr. Sister Beena Jose, Reverend Father Thomas Varakala, CMI, Counselor of Social Apostolate, CMI, Devmata Province, and also the Secretary of KESS. Our resource person for the day, Dr. Sunu Siriak, Assistant Professor, Vimala Institute of Medical Sciences, members of KESS, my colleagues, and dear participants. A warm good afternoon to one and all. As today marks the end of the International Breast Cancer Awareness Month, let our endeavors be to increase attention and support the awareness, early detection and treatment, as well as the palliative care of the disease. Today's webinar would give us more insight on the same. It's my privilege to welcome you all on this occasion. We are extremely fortunate to be headed by a principal, an erudite scholar herself, who takes keen interest in the growth of students and the college. The constant support that we receive from Dr. Sister Mabel is the reason we go ahead with all confidence. Welcome, Sister. Thank you. Reverend Father Thomas Varakala, CMI, has just taken charge as Secretary, KESS, who is also the Counselor of Social Apostolate, Devmata Province. Father has served as the Associate Director of Amla Institute of Medical Sciences and has over 12 years of experience as Coordinator of Social Work and Health. It was with so much of warmth that he accepted our invitation for associating with this venture at a very short notice. A sincere welcome to you, Father. We are honored to play host to Dr. Sunu Siriak, Assistant Professor and Head of Clinical Research Unit, Department of Medical Oncology and Hematology, Amla Institute of Medical Sciences. Dr. Sunu is an eminent speaker, a competent educator, keen researcher, and a committed social worker. I have known from some of his students and few of his patients of how a loving and approachable person he is. I accord a very warm welcome to you, sir. I most heartily welcome my colleagues, faculty members, Reverend Fathers and Sisters, all the participants to this webinar. Wishing all an enriching session. Thank you.
Thank you, Madam. Now I cordially invite our respected principal, Dr. Sister Beena Jose, to deliver the presidential address. Sister, please.
Respected dignitaries, Reverend Father Thomas Varakala, Counselor for Social Apostolate, CMI Devamata Province, and Secretary, KESS Thrissur, Dr. Sunu Siriak, Assistant Professor, Department of Medical Oncology and Hematology, and Head of Clinical Research Unit, Amla Institute of Medical Sciences, Thrissur, Dr. Sister Namita and Dr. Minimol Kejos, Vice Principals, Dr. Ruby, Head of the Postgraduate Department of Home Science, Vimala College, Ms. Betty Thomas, Convener of this program, and Ms. Urmila, the participants from various institutions, dear colleagues and my dear students. The month of October is observed as Breast Cancer Awareness Month. Today, the Postgraduate Department of Home Science, in collaboration with Kuriakose Elias Service Society, KESS, is organizing a webinar on breast cancer, challenges in detection and treatment. Breast cancer is one of the leading causes of cancer death among Indian women. More than 2/3 of breast cancer patients in India present at an advanced stage at the time of diagnosis. Early detection of breast cancer is the cornerstone of breast cancer control as described by the World Health Organization. Most of the breast lumps, more than 90%, are benign. Only few will turn malignant. But in order to identify whether a particular lump is benign or malignant, all women need to do breast self-examination or they should go for mammography. At present, many do not opt for diagnosis or treatment because women are shy. They don't complain when they find a lump in their breast. This is the reason they mostly get diagnosed very late or in the advanced stage. To overcome this crisis, the best modality is the prevention of breast cancer through breast cancer awareness program like this and breast self-examination. I take this opportunity to congratulate Dr. Ruby, the head of the Department of Home Science, and faculty members in organizing this webinar, and I sincerely acknowledge their efforts in making this happen. I also acknowledge KESS for their sincere support in conducting this program. I wish all the success to this program, and I'm sure that it will be beneficial to all of us. And today's resource person, Dr. Sunu Siriak, is a close associate of Vimala and St. Mary's Colleges because his mother, Miss Luli, was a chemistry professor at St. Mary's College. And we are really honored to have you as the resource person of today's webinar. And thank you, sir, for accepting our invitation. Thank you.
Thank you, Sister, for those warm words. Now I cordially invite Reverend Father Thomas Varakala to present the keynote address for the session. Please, Father.
Dear respected Principal, dear respected Dr. Sunisirek, and ഈ വെബിനാറിൽ പങ്കെടുക്കുന്ന പ്രിയമുള്ളവരെ, ബ്രസ്റ്റ് ക്യാൻസർ സമൂഹത്തിനിടയിൽ പരത്തുന്ന വേദന ഒരുപാടാണ്. ഒരു കുടുംബത്തിൽ ഒരു അമ്മയ്ക്ക് രോഗം വന്നാൽ ആ കുടുംബം മുഴുവനും അതിലൂടെ വേദനിക്കുന്നു. ഈ രോഗത്തെ മാറ്റി നിർത്തുന്നതിന് ഏറ്റവും കരുണീയമായിട്ടുള്ളത് നേരത്തെ രോഗത്തെ കണ്ടെത്തുക എന്നുള്ളതാണ്. രോഗം നേരത്തെ കണ്ടെത്തണമെങ്കിൽ അതിന് വേണ്ട രീതിയിലുള്ള പരിശോധനകൾ നടത്താൻ തയ്യാറാകണം. എനിക്ക് അറിയാവുന്ന ഒരു കുടുംബം തൃശ്ശൂര് മെഡിക്കൽ കോളേജിൽ, ഗവൺമെന്റ് മെഡിക്കൽ കോളേജിൽ പഠിപ്പിച്ചിരുന്ന ഒരു ഡോക്ടർക്ക് ബ്രസ്റ്റ് ക്യാൻസർ വന്നു. ആ അമ്മയ്ക്ക് അറിയാമായിരുന്നു ആൾക്ക് രോഗത്തിന്റെ ആരംഭ ലക്ഷണം ഉണ്ടെന്ന്. പക്ഷെ മകളുടെ കല്യാണത്തിന് തിരക്ക് കാരണം കുറച്ചു നാളത്തേക്ക് വെച്ച് നീട്ടിയപ്പോൾ ഡോക്ടറായിരുന്നിട്ട് പോലും പരിശോധനയ്ക്ക് ഹോസ്പിറ്റലിൽ പോയി വിധേയരാകാത്തത് കൊണ്ട് മാത്രം 4ാം സ്റ്റേജിൽ കണ്ടെത്തേണ്ടതായ ഗതികേട് വന്നു. ഭർത്താവും ഡോക്ടറാണ്, വലിയൊരു സ്ഥാപനത്തിൽ ജോലി ചെയ്യുന്നത്. എന്നിട്ട് ഈ ഡോക്ടറായ സ്ത്രീ മരണത്തിന് വിധേയയായി. മരണത്തിന്റെ മുഹൂർത്തത്തില് ഞാനുമായി സംസാരിച്ചപ്പോൾ ആ ഡോക്ടർ എന്നോട് പറഞ്ഞു, ഞാൻ ചെയ്ത മണ്ടത്തരമാണ്. നേരത്തെ പരിശോധിച്ചെങ്കിൽ, എനിക്കറിയാവുന്ന ടെസ്റ്റുകൾ തന്നെ വെച്ച് പരിശോധിച്ചിരുന്നെങ്കിൽ എൻ്റെ ജീവനെ രക്ഷിക്കാമായിരുന്നു. ഇത് അറിവുള്ള ഒരാളുടെ ഒരു കുടുംബത്തിന്റെ കഥയാണ്, അല്ലെങ്കിൽ ഒരു യാഥാർത്ഥ്യമാണ്. നമ്മുടെ നാട്ടില് വേദനിക്കുന്ന, വിഷമിക്കുന്ന രോഗികളായിട്ടുള്ള ഒരുപാട് അമ്മമാര് ചെറിയ ചെറിയ വേദനയും സംശയമൊക്കെ ഒതുക്കി വെച്ച്, കെട്ടിവെച്ച് രോഗത്തെ വലുതാക്കുകയാണ് സംഭവിക്കുന്നത്. അതുകൊണ്ട് ഈ രോഗത്തെക്കുറിച്ചുള്ള അറിവ് സമൂഹ ജനത്തിന് കൊടുത്തു കഴിഞ്ഞാൽ, അവര് ഇത് പരിശോധനയ്ക്ക് വിധേയമായാൽ, നേരത്തെ ഈ രോഗം കണ്ടെത്തിയാൽ ആദ്യത്തെ 2 സ്റ്റേജുകളിൽ നമുക്ക് അവരെ ചികിത്സിച്ച് ഭേദമാക്കാനായിട്ട് പറ്റും. ചികിത്സിച്ച് ഭേദമാക്കുക എന്നുള്ളത് നമ്മുടെ ഓരോരുത്തരുടെയും ഉത്തരവാദിത്വവും ദൗത്യമാണ്. നമ്മുടെ അമ്മമാരും നമ്മുടെ പെങ്ങന്മാരും അസുഖത്തിൽ നിന്ന് മാറി നിൽക്കേണ്ടത് എന്റെയും നിങ്ങളുടെയും ഉത്തരവാദിത്വമാണ്, കടമയാണ്. അതിൽ നിന്ന് ആർക്കും മാറി നിൽക്കാനായിട്ട് പറ്റില്ല. അതുകൊണ്ടാണ് 1 മാസം ദീർഘിപ്പിക്കുന്ന ബ്രസ്റ്റ് ക്യാൻസർ അവയർനെസ് മന്ത് ആചരിക്കുന്നത്. അപ്പോ ആ തീവ്രതയോടുകൂടി ഈ വിഷയത്തെ സമീപിക്കാനും ഇതിനോട് പ്രതികരിക്കാനും വിമല കോളേജിലെ ഈ ഡിപ്പാർട്ട്മെന്റുകൾ കാണിച്ച ഔത്സുക്യത്തെയും അതിന് കാണിച്ച അവരുടെ തീവ്രമായ പ്രവർത്തനം ഇതിനെയും ശ്ലാഘിക്കുന്നു. ഇതിനോട് സഹകരിച്ച എൻ്റെ KESSിലെ സകല സഹപ്രവർത്തകർക്കും നന്ദി അറിയിക്കുന്നു. ഇത് ഈ ക്ലാസ്സിലൂടെ വിവരങ്ങൾ അനുഭവിച്ചറിഞ്ഞ് മറ്റുള്ളവരിലേക്ക്, നമ്മൾ കാര്യം കേട്ടതുകൊണ്ട് നമ്മുടെ കുടുംബത്തിലും നമ്മുടെ ചുറ്റുവട്ടമുള്ളവരിലേക്കും ഈ അറിവ് പകർന്നു കൊടുത്തുകൊണ്ട് ഈ ഒരു അറിവ് എല്ലാവരുടെയും സാമാന്യമായ അറിവാക്കി മാറ്റുവാനുള്ള ഈ ശ്രമത്തിന് എല്ലാവിധ വിജയങ്ങളും നേർന്നുകൊണ്ട് ഞാൻ നിർത്തുന്നു. നന്ദി, നല്ല നമസ്കാരം.
Thank you, Father, for your wishes. Now we can all move on to the much awaited webinar session. There will also be an interactive session following the webinar, and all participants are requested to type in your queries in the chat box accordingly. Also, a kind reminder for the participants to type in your email addresses in the chat box for providing the feedback forms and certificates. I invite Dr. Thrissur, Assistant Professor, our resource person for the day, to begin the webinar session. Welcome, sir.
Hi, am I audible?
Yes,
Yes,
sir.
sir.
Yes, hi. So good afternoon to all of you, and thanks especially to Kuriakose and the organizers of this program for inviting me here. Kuriakose ഇന്നലെയാണ് പറഞ്ഞത് ചെയ്യാൻ പറ്റുമെന്ന് ചോദിച്ചത്. Kuriakose ഇന്ന് ഉച്ചയ്ക്ക് വന്ന് പറഞ്ഞാലും ചെയ്തിരിക്കും. അതാണ് Kuriakose ഞങ്ങൾക്കുള്ളത്. സോഷ്യൽ സർവീസിന്റെ ഒരു മേഖലയിൽ Kuriakose കഴിഞ്ഞിട്ടേ ആരും ഉള്ളൂ. അതുകൊണ്ട് ഞങ്ങൾക്ക് എന്ത് ആവശ്യമുണ്ടെങ്കിലും എസ്പെഷ്യലി പേഷ്യൻ്റ് റിലേറ്റഡ് ആയിട്ട് നമുക്ക് ഇതുവരെ അങ്ങനെ ഒരു അവസരം വന്നിട്ടില്ല. അതായത് പൈസ ഇല്ലാത്തതുകൊണ്ട് ഒരു പേഷ്യന്റിന് ട്രീറ്റ്മെന്റ് കിട്ടാതെ അമലേന്ന് ഉണ്ടാവാനുള്ള സാധ്യത വളരെ കുറവാണ്. അതിന് ഏറ്റവും മുഖ്യമായിട്ടുള്ള ഒരു കാരണക്കാരൻ എന്ന് പറയുന്നത് വാഴക്കാലച്ഛനാണ്. അച്ഛൻ ഇന്ന് ഉച്ചയ്ക്ക് വന്നിട്ട് പറഞ്ഞാലും ഞാൻ ചെയ്തിരിക്കും. എന്നിരുന്നാലും പ്രസന്റേഷനിൽ there might be some pitfalls in the presentation because it was made in haste, so please pardon me and I will go to the presentation. Thanks to the principal, Sister Beena Jose and Varakalachan, because you have given an elaborate introduction that I think the skeleton of my talk is already covered. I just need to put some frills here and there to make it a little bit more interesting and informative. So let me start sharing the screen. Is my screen visible?
Yes, sir.
Okay.
Yes, sir.
So I work in the Department of Medical Oncology and Hematology here at Amala Hospital, and as Sister mentioned, I am a pure, complete Thrissurite. My mother worked with the CMC province in St. Mary's College. I haven't visited Vimala College, but I have been to many of the CMC programs. So I'm once again happy and thankful to give me this offer to present this. So without wasting much time, let's go into the presentation. So before going to the details of the breast cancer, I want you to go through a little bit of the numbers and get an idea about what's happening in breast cancer in the world level, in India level, and more regionally in Kerala level. If you see here, the pink color is the breast cancer. This is for both males and females together. If you see the total number of cancers, breast cancer ranks as the #1 new cancer cases. But fortunate enough, the number of deaths from breast cancer is slightly lesser than a few other cancers which are more deadlier than breast cancer. The reason for which I'll come to you later. If you look into females alone, you can see that breast cancer is by far the highest number, by far having the highest numbers. Again, the mortality rate or the death rate from breast cancer is much lesser than the total numbers, which indicates that the treatment results are a little bit better for breast cancer. Again, globally, coming to continent-wise, if we see breast cancer, if we look at breast cancer, we can see that half of all the breast cancer occurs in Asia and Africa. This is just a reflection of the number of the population. But in fact, the population of Asia and Africa together might be more than half of the whole world, but still it's around half. The sad fact is that the patients, there is a higher incidence of death from breast cancer in Asia and Africa, unlike in Europe and America. This is a reflection that there are more number of patients who are diagnosed in Asia and Africa, but the cure rates are not as good as what's happening in North America and Europe. This is again a reflection of the previous slide, what I mentioned. If you look at the left side of the graph, we can see that these are the countries which are so-called the developed countries: Australia, New Zealand, European countries, and North American countries. Whereas this is where India belongs to. We can see that the red line indicates the total number of patients, as well as, but this blue line indicates the number of deaths that's happening. So we can see that in the developed countries or North American, European countries, though there is a high number of breast cancer cases, the total number of death is much less because of better treatment. Whereas in India, we are yet to catch up with those numbers. Now coming to India, if we look into both sexes, both males and females included, still breast cancer is currently the highest, having the highest number of the incidence-wise. Breast cancer is the highest in India. A small time trend that I want you to see what happened in 1990s versus 2016s. The map on the left shows 1990s and that on the right shows 2016. The numbers were not so huge in 1990s. There might be a little bit of margin of error for less number of data capture. Data capture is much more better now. The registries are functioning much more better now, but still it was much less. And this is really documented in most of the studies that the incidence of almost all cancers are increasing all across the country. And now Kerala has got one of the highest incidence of breast cancer. Kerala and Mizoram might be the states, and Delhi might be the states with the highest incidence of breast cancer. We have even surpassed most other states which were ahead of us. A big factor for us is the lifestyle related issues, which we'll discuss soon. Coming more focused to Kerala, this is a registry data from Trivandrum Regional Cancer Center, Trivandrum. You can see that over a period of the last 15 years, there is a steep increase in the number of breast cancers that's happening. It's almost getting double. This is almost the predicted value where we are currently, and it's almost more than double as what it was in 15 years back. There is definitely an increase in the number of cases. It is not just that it is detected early. It is not just that we are finding better facilities are there. There is certainly an increase in the number of newly detected breast cancers in the state of Kerala. Now, is there any change in the age group that was happening? Here, the blue bars indicates what was happening 25 years back. We can see that predominantly it was a disease that affected more than 50 years. 50 years to 60 plus was predominantly the age group. But slowly, the trend is reversing. That there is more number of younger females, especially in the 30s and 40s. The number of patients who are coming in their 30s and 40s is sharply increasing. This is again a pattern that is seen in the Western countries where there is more number of younger females that's happening. Interestingly, there is more, the life expectancy is increasing, our elderly population is also increasing, but unlike that, there are more number of younger patients with breast cancer coming up nowadays. So can I prevent the breast cancer? If somebody asks that, we first need to understand what are the risk factors for breast cancer. Once we know the risk factors, we can see what all are the things that we can prevent. Just follow this line, and this line indicates this intensity of association of any risk factor with breast cancer. Top of the line, top of this arrow, we have obesity, and this is one of the most alarming things that has changed the whole statistics of breast cancer in the last 20-25 years. There is high, the mean body weight or the obesity levels are markedly increasing as well in our state also. This is just a reflection of what's happening in the Western countries and North America where obesity is rampant. The more there are a number of obesity, and there are scientific reasons for this which are linked to the fat tissues that gets deposited in the body. So there's a lot of hormone related activity that's happening in the fat tissue, and breast cancer is one cancer which is closely linked with hormonal activities. Closely associated with obesity again is the lack of exercise, which leads to obesity. There is slight exposure to radiation. The radiation, if you're exposed to radiation in your early life, if unfortunately you met with a radiation accident anywhere in any part of the world, there is a slight chance that you might develop a breast cancer in the future. Not a slight chance, a good chance that a breast cancer exposure is, breast cancer occurrence can happen. But remember, radiations like X-ray or mammogram are all also radiation, but the doses are really very less to produce cancer in your lifetime. So unprocessed and fatty food, these are the things that's changed completely our lifestyle. Obesity, lack of exercise, sedentary lifestyle, and eating a lot of processed and fatty food. We are still not anywhere near to what's happening in the Western countries, but we are catching up. If we don't take control of this at this point of time, in another 20 years, we will be very near to what's happening in the Western countries. But unlike the Western countries, our treatment facilities are not catching up as fast as that because of so much of financial reasons. So our death rates also might be very high, unlike the Western countries. Other reasons are much related to the hormone and menopause and menarche. The menstrual period has got a very intense relationship with breast cancer. The longer a female is exposed to the menstrual hormones, especially estrogen and progesterone, there is a slightly higher chance that there is a breast cancer risk. So if the female has got an early menarche or a late menopause after 55 years of age, the breast tissues are exposed to estrogen for that long period of time, and that can lead to a higher chance of breast cancer occurrence. Also, certain hormone replacement therapies and all those things can have a higher incidence. Not breastfeeding after giving birth puts a woman at a higher risk. There are some small age related. Age was once upon a time considered to be a very important factor because it was considered as a disease of the elderly age group, but that's slowly changing, and now it's happening even in the younger age group, as I had mentioned earlier. So having no children, not breastfeeding, early menarche and menopause, all these are hormone-linked associations with breast cancer. So how can I prevent all these things? Like the first three things that I mentioned: exercising and proper diet. Control your body weight. The chances of breast cancer will come down nicely. So maintaining a healthy weight is the key parameter. Alcohol has got some association, but this association is not to be, at least for the time being, it's not so big an association in our part of the world, but it could change, and that's also a factor. Now, one question that people commonly, very frequently ask is, one of my relatives has got a breast cancer. What is the chance that I might also have breast cancer? So technically, you need to know about two terms. One is a familial cancer, one is a hereditary cancer. To give a small background of this, let me tell you that a familial cancer is a bit different from hereditary cancer. Hereditary cancer is more of a scientific terminology. Of late, in the last 20 years, we have learned a lot about the genetics of cancer, and now we are accepted the fact that cancer is a genetic disease. When we say that cancer is a genetic disease, it does not mean that it runs in families. It means that there is some problem in the genes that's present in the cells. These problems are grossly called mutations. Some mutations or changes or aberrations happens in the genes, and that can eventually sometimes lead to a cancer. So there has been some genes that has been found out so far, which has got a higher chance of producing a breast cancer. And this has been rightly named as the BRCA, or it's also called the BRCA or the breast cancer associated gene 1, breast cancer associated gene 2. And this actually contributes to only around 5 to 10% of the whole number of cancers. The rest, you can get a very strong family history in many families, but even if you do the genetic analysis, still you won't find a gene that's defective. These are called the familial incidences. So these familial cancers contribute to around 10 to 15% of all the cancers. So grossly, if you see, still to date, around 80% of the cancers happens just like that, without any familial incidences, without any hereditary occurrences. But remember that if you have a family member who has a breast cancer, you need to be a bit cautious. Now, what are the breast cancer risks? The family history patterns that should raise a red flag for you. Just because that somebody in your family had a breast cancer does not mean that you should be very apprehensive. These are a few of the factors, not all inclusive. If you have more than one relative with the same type of cancer, there is a tendency that that family might be having some abnormal gene inside them. This could be breast cancer, this could be uterine cancer, this could be ovarian cancer also. Breast cancer is considered to be a cancer of more of the female gender, but if you have a family member who is a male and had a breast cancer, so understand breast cancer can happen in males also. If there is a family member with a breast cancer who is male, that should also raise a red flag for you to be cautious for this. Now, if there is one individual in the family who had more than one type of cancer, rarely these are also being seen more commonly nowadays. So a person had a brain tumor with a breast cancer and an ovarian cancer. There is a chance that there is something abnormal inside this patient. And being a relative, you should also be a little bit more cautious, and there are things that you need to think about and do at that time. Now, if there is a patient or a relative of you, or one patient has got breast cancer in both breasts, if these cancers happen like this within a period of around 6 months or so, there is a chance that this is more likely a genetic disease. So these are red flag raisers. I don't want to make everybody apprehensive because any of your relatives, if they have a breast cancer, it should not immediately raise a red flag. If there are some things related to this, there is a higher chance that there might be something that's running the family, and you should be a little bit more cautious in that sense. In that sense, when we talk about BRCA, I know that all of you know who this lady is and what she did to oncology. Fantastic lady, fantastic actress. one day she understood that she was harboring this abnormal mutation. She didn't have a breast cancer, she didn't have an ovarian cancer. She went for not a routine check, she went for a screening test with this gene, and then she found that she was harboring this abnormal gene in her genes. Data says that if there is an abnormal gene in the BRCA, there is a high chance that you might end up getting a breast cancer or an ovarian cancer. Like up to the age, by the age of 70, if there is a youngster with a BRCA gene which is mutated, by the age of 70, there is a high chance that chances around 50 to 60 to 70% chance that you will get a breast cancer. Similarly, there is a 40 to 50% chance that you could get an ovarian cancer. So what did this brave lady do? She went and did a bilateral mastectomy. Can you imagine a Hollywood actress removing both her breasts? She did it because she knew that there was a higher risk of breast cancer in her body. After that, she also understood that breast is not the only organ affected by this BRCA gene. It can also be affected by ovaries. It can also affect the ovaries, and she also went for a bilateral oophorectomy also, ovary removal also. So that is the kind of impact BRCA is producing in many women. So if there are some ways by which I can detect it early, there are some ways, and the classical and here I want to tell you that breast cancer is one of the cancers which has got the highest chance of being detected early. That's because the breast lump, that is the most common symptom for a breast cancer, and that's easily palpable, and it produces a symptom much before it spreads to somewhere else. So it's very frequent that you will encounter, a patient might encounter a breast lump in her breast on routine palpation of her own breast, and then she will go and get that evaluated, and she will, and the diagnosis comes out. So together with this, that is what is called as self-breast examination, what sister was mentioning previously. Together with that, this can be aided by a few other investigations also, which are now mainly called the mammograms or the X-ray of the breast. This gives us a hint of whether there is a high likelihood of something that's going to be abnormal. So all this risk, as we mentioned previously, it's more of an elderly age group, more of the 30 plus, but the current guidelines also mention that about 40 years of age, it is better that you should go for screening mammograms. Now, mammograms versus ultrasound, there is also the random use of ultrasound, and nowadays there is more use of combined modalities of sonomammograms, where ultrasound is also done along with mammogram, which has got a better diagnostic accuracies. If the breast is having more fatty tissues, then it's better to use ultrasound, and it's better to use ultrasound as a primary modality. And if the breast is not having too much of fatty tissue, and more like in an elderly lady, postmenopausal ladies, it's better to use a mammogram. Now, this is what Susma was mentioning previously about self-breast examination. It has to be done at any age. There is no age limit, or there is no earliest age that you can start. Any youngster should start doing a breast self-examination, and any changes can be multiple, which I'll show later. It has to be done in multiple positions, and you can get enough and more of information from the internet about as to how it has to be done. So what are the symptoms of a breast cancer? So these are the things you should be aware when you're doing a self-breast examination and otherwise also. It's not always a breast lump alone that can happen. It can be a small color change. So you should always be cautious about as to how things are changing over a period of time. It can be a small color change. It can be a small lump. It could be something like a small gland over your clavicle or the collarbone, or in the root of your neck. There might be a small gland. Important thing is about the nipple changes. The nipple changes can be a very big forerunner for a malignancy or a cancer. The nipple can get retracted like how it goes inside. There might be abnormal discharges from the nipples, which is mainly red in color, or bloody discharges. And the shape of one breast might be changing as compared to another breast. That's basically because the tumor is pulling the skin inward, or the muscle also inward towards the chest wall, and that changes the shape. So all these things should alert you towards what's happening, towards further evaluation and ruling out any untoward diseases. So suppose you felt a lump, what should you do next? If you have felt a lump, there are few lumps which are related to menstrual periods. which disappear after the menstrual period is gone, or in a week or two, it will disappear. If you feel that the lump is not disappearing even after, it's not related to your menstrual cycles, you should get it evaluated, especially if that is a new lump. The first and foremost test might be a breast imaging with an ultrasound like the mammogram, and also associated with it, it's always better to do FNAC from the lump if possible. If there is any abnormal cells that's found, then it's better to do a biopsy. A biopsy and FNAC is different. A biopsy is a little bit more cumbersome procedure, and FNAC is a much more easier thing. And FNAC means basically it's a needle that goes inside. This is the biopsy actually. You need the ultrasound probe, and you put a larger bore needle inside and pluck out a chunk of tissue, a small chunk of tissue outside. The FNAC is done with a syringe, help of a syringe. It's a small needle that goes in and takes only a few cells, not a tissue, not a blob. It just takes a few cells. And seeing the character of the cells, we might be able to mention that it's cancerous or not. So that's how you need to approach if you feel that there is a lump. Now, unfortunately, if somebody gets diagnosed with a breast cancer, what next? Are all breast cancers the same type, and are all of them treated in the same way? No. Breast cancer was one disease almost 30 years back. At that point of time, we knew that it was just a breast cancer, nothing else. But now we know that there are so many types and different types of breast cancer. When we say that there are different types, what is the implication? The different types means that they are presenting differently, they behave or progress forward differently, and they are treated differently. Their outcomes are also different. If you watch closely, many of your relatives, friends, or many other people, you might have heard of many stories where people are telling that I had a breast lump removed some 30 years back, and now I'm all fine. There might be another lady who says that I had a breast lump 20 years back, I removed it, and after 15 years, the breast cancer came back. After 15 years, can you believe a cancer coming back after 15 to 20 years? There might be another lady who comes and says recently that she was she was a young lady, and then she had a breast lump identified as an early stage breast cancer, but after all the treatments, despite all the treatments, in 2-3 years time, she had a recurrence of the breast cancer. All these are treated in different forms. So, however, there are some standard modalities of treatment for breast cancer. These includes the primary and most important modality is our good old surgery with scalpels. Then comes the radiation. Not all patients after surgery might need radiation, chemotherapy, and then there are the hormone therapies. I tell about hormone therapy basically because breast cancer is one cancer that's linked a lot with hormones, especially estrogen. So manipulating the hormonal character or hormonal environment around the tumor itself can produce a good result in cancer treatment. And then of late, there are new kits on the block called targeted therapies and immunotherapies, which are still much investigation, but are still promising. So is breast cancer curable? Stage 0 or very earlier stage when there is something called some abnormal cells alone that's present there, it's 100% curable. Stage 1, fantastically curable to 100%. And this is where the Westerners have changed things in their favor, that they're trying to understand, they're trying to find out or pick up all the breast cancer in the earlier stages by screening mammography, screening procedures, early awareness, more aware, better awareness, and all those things. And that's where you can see that in stage 2 and stage 1, that survival means almost 90 to 100% of the patients will be cured of the disease. Unfortunately, the more it spreads, the less the chance of cure. If it unfortunately comes to the stage 4, still there is a 22% chance of cure. But it's low, but still there's a chance of cure. So this is where Europe and North America is trying to change things by catching them early. And this is what the importance of mammogram and ultrasound, self-breast examination, clinical breast examination, all this lies. And this is where they have changed. If you remember the graph that I mentioned, I showed you earlier, you can see that in India, almost 50% of the patients would die at some point of time, whereas in the Australian countries and Europe, even though the numbers are really very high, the number of patients dying because of breast cancer is really very minimal. And the reason why it is because of this. In India, more number of patients are presenting in later stages, leading to poorer outcomes. So it's not only the treatment facility, lack of treatment facilities, it's also an advanced stage which changes the things. Surgery for breast cancer conventionally is the surgery that happens right from almost 200 years or more before, was removal of the complete breast. Initially, they removed the complete breast alone, but then they understood that even if you remove the breast, it's coming back somewhere. So then they understood that there's something known as the lymph nodes which are draining from this breast into the axilla. Into the axilla, there are so many small lymph nodes. All these things are also harbingers for tumors, and so this also has to be removed. They understood that breast cancer, remove the breast with the lymph nodes. So that is what the current standard is. Well, that's something called modified radical mastectomy. So as of now, is removal of the breast mandatory? If somebody had a very small tumor, like 1 or 2 centimeter tumor alone, is it mandatory that we need to remove it? No, there are other options also. Even if the tumor is large, still we have the option. We can still save the breast, especially in younger ladies who are coming up more and more and asking for conserving the breast, removing the tumor alone. This is what's known as the breast conservation surgery. If the tumor is really very small, you can remove the tumor upfront with just this tumor and 1 or 2 centimeters around it. Remove 1 or 2 lymph nodes that's found significant, and then do the rest of the treatment. The breast stays intact. But if suppose the tumor was large, occupying a large volume, it might not be easy to remove the tumor alone. You might need to, because every time you do a removal of a tumor, you need some normal tissue also to be removed. So if the tumor is large, you might not get enough of normal tissue. So what you can do is that still if the patient wants to preserve the breast, what you can do is that you can reduce the size of the tumor by giving chemotherapy in the beginning, not going for surgery, but giving chemotherapy in the beginning, reducing it nicely to a smaller size and then removing it. This is producing fantastic results, and this is what is called as the neoadjuvant approach. You first approach with chemotherapy and then you go with surgery. You preserve the breast, but much depends upon the character of the tumor and size of the breast. So after surgery, you need many treatments. Almost around 20-30 years back, continuation treatments were not so common in India, but in the last 20-30 years, we have understood that we cannot leave a breast cancer patient just like that after surgery. She needs much more associated treatments, basically because there's a higher chance that these things can come back. So is chemotherapy must for one of the important treatments is chemotherapy, and is chemotherapy must for breast cancer? It's almost needed in most of the breast cancers, except if it is really very small and if the hormone characteristics are of the peculiar kind. Apart from that, in most of the cases, we will need a chemotherapy, and this is one thing that most of our patients do not like, basically because of the side effects associated with chemotherapy. So the chemotherapy can produce lots of different small side effects, but the predominant ones I would like to tell about is about the hair loss, about the nausea and vomiting, about a little bit of the neuropathy. And there is a little bit of bruising and bleeding at the site of injection especially. So these are the predominant things, and there are rarer side effects, multiple rare side effects, which we are not going to discuss. One of the most important side effects that many of my patients come and ask me is that, is hair loss mandatory? Should I go through all this hair loss always? So as of now, for breast cancer, if the breast cancer has not spread far and wide, this treatment world over is almost standard. We don't have too much to think about and too much to choose from, because this is what's practiced world over. In that situation, it almost produces hair loss. It's really disturbing for the patients, but we are looking from the perspective of life also. We don't want the tumor to come back and create more problem at a younger age especially. So we advise them that hair loss is very likely, and it's better not to change the chemotherapy just for the hair loss. But there is hope coming up in the horizon, like this machine is standing. This is not a standing fan. This is something called as the scalp cooling machine. What they do is that they put something around the scalp. This is still coming up, and the results are not so glorious, but might be in a few years it will get more and more refined, and we'll get better answers. What they do is that they cool your scalp when the chemo is being given. The chemo is going, the scalp is getting cooled. So whenever some area in the body gets very cold, what happens is that less of blood goes to that part. When lesser blood goes to that part, lesser chemotherapy reaches the scalp, producing lesser hair loss. That's a principle, and it is having early successes, but there are some issues also. It's yet to catch up, but hopefully in the next few years, this will be available in many parts of the country as well. So hair loss for now, we do support with support all of patients. In Amala, we have another of our associate director, Father Jason, also, who is doing a lot of work for this patient, especially in the hair loss sector. He is arranging, currently because of the COVID pandemic and all, things are getting a little bit slower. But we used to arrange with the help of Father Jason Mutmani, a free week for most of the patients, especially of breast cancer who are going on for chemotherapy. I think many of you would be aware of the campaigns that he does to collect hair also to make this free weeks. So I talked about these things and hormone treatment. Once the treatment is the chemotherapy treatment is done, the other thing is about radiotherapy. I'll come to the hormone therapy after this because this needs to come first. So radiotherapy is needed. Radiotherapy is one form of local treatment. When I say local treatment, the treatment is focusing on the breast alone. Chemotherapy, we are giving it into the blood and it circulates everywhere inside the body, and so it's something called systemic treatment. So chemotherapy flows everywhere in the body and kills all the cancer cells that might have escaped from the breast and other parts of the body. Whereas radiotherapy is again a focused radiotherapy being directed on towards the breast, and this is another form of localized treatment just like surgery. And in many cases, we will need to support this thing with the surgery with the radiotherapy. You remember previously, earlier I told about two different types of surgery. One was complete removal of breast and the other one was breast conservation. You take out the lump alone. If you are taking out the lump alone and retaining the breast, it should mandatorily be followed by radiotherapy. That is how the equation works. Breast conservation surgery plus radiotherapy is equivalent to complete removal of breast. So does that mean that if you remove the breast, you do not need radiotherapy? No, there are certain other indications which will produce this. So the thing that can be said for sure is, if you are retaining the breast, you will need radiation. If you are removing the whole breast, still there are instances where you will need radiation. So coming to hormone therapy, we usually supplement all these treatments with hormone therapy. The hormone therapy is basically because most of the breast cancers are hormone dependent, and this hormone is estrogen or progesterone. So these hormones are really important in the growth of breast cancer cells, and you suppress these hormones by some way or other with tablets, by removing the ovary, by stopping the activity of the ovary temporarily, you get a better result. So all these things are added. There is no one single modality which will produce all these results. Surgery alone, there is a high chance of coming back. Chemotherapy alone, no chance of cure. It should be with surgery. Targeted therapy or hormone therapy, everything should be joined as in a sequence, and that sequence is something that we determine in the beginning. And this is the new kid on the block, that's immunotherapy. You might be hearing a lot about immunotherapy nowadays, and this is really conquering the world, and this is the new hope, they say, but a little bit of hype is also there. Because when we hear about immune, we always feel that we are just doing something from ourselves. It is something that we are doing from ourselves, but classically, an immunotherapy in this modern medicine setting is not just about boosting immunity. You might get so many byproducts or so many over-the-counter products which will claim that this can boost your immunity, but the problem is that those immune boosters are not as good to help boost the immunity of a cancer patient, because the kind of immune boosting that's needed to fight cancer is too huge. If it does not complicate you, I'll just give you a 1-minute description about immunotherapy. Any cancer develops from one cell. That one cell multiplies into multiple number of cells and keeps growing. Parallelly, there is a policing system inside the body called the immune system. This immune system keeps a good tab on anything that's happening abnormally inside our body, including cancer cell formation. So every other minute or every other day, some cancer cells are keeping on forming in all our bodies, and our immune system is keeping a check on that. You boost your immune system at that time, it might help, you do not know. But unfortunately, one or two of the cancer cells escape or hide away from these immune cells and grow into a tumor. That's how a tumor happens. Once this grows into a tumor, then your immune system is insufficient to attack, because the number of cells that grows into a tumor is huge. Your immune system has got a certain minimum capacity. It cannot attack them. What you need to do is that you need to treat it and get the tumor number cells to a definitely low level where our immune system can take over. So the conventional immune boosters that you get from over the counter cannot help boosting an immunity, or these are not real immunotherapies that can kill or attack a cancer. This might be able to help you as a normal person, but if you are having a cancer, please don't rely exclusively on those over-the-counter immune boosters, because they have their own limited capacity. They can work only to a certain level. This immunotherapy that we are talking about is a little bit too very advanced, in the sense that it is something like the standard immunotherapy is something like they are taking your own lymphocytes or the cells, immune cells from your body. They're multiplying it by a million times. They're modifying it specifically for the tumor. How they do is that they take the tumor, they understand what's special in the tumor. They take the immune cells from your body and incorporate special weapons into your own immune cells to attack the tumor. And then you multiply those immune cells to millions and millions of times, so that they grow to a number that's sufficient to attack the tumor cells. They put it back into your body, and that immune cells which are having new weapons targeted against the cancer cells will go and attack it. So immunotherapy is a bit complex, but it's surely giving new hopes against cancer patients. Associated with it, frankly, I will say that there is a little bit of hype also for immunotherapy. It's still in the investigation stage for many cancers. For many cancers, it has proven to be good. In breast cancer, it is still coming up. Now, what are the other hopes for a patient? These are the clinical trials in cancer treatment. The clinical trials once upon looked upon by all of us as something like we are very much averse about this, because this is going to make us as a guinea pig. But understand that almost all the new drugs that has come into market as of today, including your very sweet paracetamol also, these things has all gone through a series of clinical trials and testings in various parts of the world, including many times in India as well. So the clinical trial is essential in modern medicine to get a medicine to market. Without a clinical trial, we are not allowed to use medicine. So what is the advantage of having a clinical trial? Clinical trial, especially in oncology, gives a huge number of options for patients who otherwise have finished their options. Like a patient who had multiple recurrences of diseases 2 or 3 times, they are still struggling to find options. It might be at that point of time that we have some clinical trials with some new molecule. We do not know, that's good. We do not know what is going to happen. But if the patient can take a chance, if the patient does not have any other option, this is certainly new options. And the most number of clinical trials as of now is happening in the field of oncology, because there are so much unmet needs that's happening in our oncology patients. Soon we'll be starting clinical trials in Vimala Hospital also as part of the research projects. And we are trying to do it in the most ethical, and that was the main concern. There are so much issues related to ethics and all those things. All those things are getting cleared by the government of India and other ethical guidelines bodies. And we will also be soon starting clinical trials. So, unfortunately, if one of you gets diagnosed with cancer, what should you do? How should you select for a treatment center? There are so many things that can determine the treatment center, and you should choose wisely. A few of the 2 or 3 things that you should always note is that how good is the team there? Cancer is no longer a one-man show. No one person can treat cancer alone. It needs a huge team. It means, if I say huge, it's huge. There is a medical oncologist, there is a radiation oncologist, there are surgeons involved, there's pathologists with expertise in the field of cancer, the radiologist who needs to look at specifically every areas where it has spread. There's palliative care team, there are nurses, physiotherapists, dietitians, pharmacists, etc. So many people are interlinked in all these things. So that is where the concept of tumor board came up in the last 10 years or so, and we are also catching up soon with tumor boards. We also have a well-functioning tumor board in our hospitals. The tumor board is a place where all these people sit together. They discuss the findings of a patient's investigations report. The patient can be there, the patient need not be there. The hospitals which offer the patient also to be in the tumor boards, and they discuss about the patient's disease and they find out what is the most appropriate treatment. So it should not be a factor that one person decides that I want to operate this patient, or another person decides that I want to give first chemotherapy. They sit together and reach a consensus as to what is the best practice. And then the treatment is offered to the patient, and then the treatment is delivered. The second thing that you always need to look is to the affordability. Cancer treatment is one area where there is so much complaints against the cost of treatment. It's food. It's basically because most of these medicines are coming from outside, and these things are really becoming costlier. And generics are coming up, reducing the cost, but still the length of treatment, because it needs multiple modalities like surgery, radiation, chemo, hormone, all those things, the treatment cost is bound to be high. The treatment duration is bound to be high. And over the period of time, when you're getting the treatment, your job can be affected, your income can be affected. So there is a huge financial in all this. All these things has to be taken care when we decide for the treatment. So that should also be one thing. And I would strongly urge all of you, because in India, the system is that there is no one single payer for the patient. It's either the patient pays from out of their pocket, or if you take an insurance, you'll get it. If you have the central government project or central government fundings or supports, you'll get that. If you go to countries like Canada, the whole treatment cost is borne by the government. In the US, it's completely taken up by the insurance companies. In the European countries, most of them, it's the government that takes up. Unfortunately, in India, it's a mess. We have multiple systems operating together. So ideally, as of now, till we have, because there are still promising things like Ayushman Bharat and all those things coming up. The concept is really nice, but the feasibility is, they're still working on the feasibility. If it comes out, it's one good project. And till then, I think all of you should seriously consider about taking a good insurance for you and your family as well. Accessibility to the treatment center is the other thing, and that's basically because I'd say that most of the cancer treatments are quite long. You have a good hospital which is very far away, but you need to go there every now and then. In between, it should not be a situation that you stop the treatment in between because you cannot go there anymore. So choose a hospital that's also 40 years, 40 to 50 years also it's climbing. So do not neglect a breast lump in a lady who's around 30 to 40 years or so. So it has to be evaluated. Previously, 20 to 30 years, most of the breast lumps do happen, but most of the breast lumps used to be benign or non-cancerous things. Still 20 to 30 is still not so rampant, but 30 to 40 certainly you should be a little bit cautious.
Okay, sir, thank you so much. Also, few of them actually are worried about children as well. Is there a chance of younger children developing breast cancer?
So that's the, if you remember the previous, it's very, very, very rare for somebody to get a breast cancer less than 20 years. But I haven't seen, but I have seen people who have seen patients of breast cancer at the age of 18 and 17 also. Very rarely something below that.
Okay, sir, thank you. Another query is regarding the detection of breast cancer. As discussed that during the examination, if we find a lump, we can probably say that there is a chance of developing. But is a moving or a sliding lump also considered as a symptom?
So lumps can have multiple characters. This sliding lump or something what they call as a breast mouse is usually not so typical about breast cancer, but One thing that we need to look closely is that look for any change in the character of that breast lump. Is the lump increasing in size? Is it coming more nearer towards the skin? Is there something in the axilla that's parallelly developing? Any of these signs, go and get it biopsied and prove that it is not a cancer. Most of the sliding lumps are benign. Usually you should not be a major problem.
Thank you, sir. Another query we have here is regarding a mammogram. How do you comment on a mammogram with a BIRAT score of 3?
BIRAT score of 3, usually we do not need to intervene at that point of time. Usually we ask them to keep it in a close follow-up and then repeat something in another 6 months or so. If its BIRAT score goes into 4, then we always certainly tell them to go get a biopsy. It's good that people know about this BIRAT score and everything. Great. So I think I should have gone a bit more deeper into the technicalities.
Okay, sir. Another question regarding the immunotherapy. So, as mentioned, are there any food supplements that can be used in immunotherapy?
So immunotherapy, as I mentioned previously, I'm not sure whether I was a bit fast when I was talking about immunotherapy. So immunotherapy, immune boosters, foods that you get from over the counter and or from the market and all those things, it might help a little bit if you do not have a disease. In a disease state, something has taken over your normal immune system. Your immune system is something that protects you from anything and everything, including tumor, including infections and many other things. And bacterial infection, viral infection, everything is taken care of by the immune system. If you get if you get a disease like a cancer or an infection or something, that means something has overcome your immune system or overwhelmed your immune system. That your immune system is no longer strong enough to attack that. That point of time, relying only on food supplements and all those things would not be the right thing to do. Definitely, parallelly, you might take a little bit of additional some things as a food supplements or so. There's nothing that's proven as such, but there's so much of investigation that's going on in the world of turmeric or curcumin and all those things, including our institution as well as Rajiv Gandhi Center for Biotechnology in Trivandrum and many parts of the world. So much of investigation going on in this field, but there is so much of pitfalls that's happening. There are many things that works in the lab. That's how many hype happens. Understand that there are so many things, when there is a research that's happening, things first happens in the lab, in a petri dish, you know that. It then gets done in a mice or a pig or something like that. After that, slowly, it starts getting tried in human beings. So it's a long process. It's not overnight that defines something. So the immune therapy, whatever, there's so many immune things that we're testing. Many of these things are working in the petri dish, but when it converts, we try to do it in an animal, it fails. Some of them works in the animals, but when you try to convert in the human being, it fails. So there are only very few things that could be with the real hardcore immunotherapy is a different world. Apart from that, food supplements and all, there won't be anything that can replace other treatment. There should not be something that replaces other treatment modalities as an immune booster also. You can add it to the treatment, but do not replace it.
Thank you, sir. Another query is that any comorbidities like hypothyroidism or something, can it be considered as a factor to develop cancer?
Hypothyroidism is not a risk factor for cancer. Diabetes is another comorbidity. Diabetes is not a risk factor for cancer. Hypertension is not a risk factor for cancer. Another comorbidity is obesity. That is the biggest risk factor for breast cancer. Obesity is really a scary risk factor. Otherwise, hypertension and diabetes and hypothyroidism are not risk factors for cancers.
Thank you, sir. Query is regarding a pain in the breast. Rather than the lumps, is a breast pain can be considered as a symptom?
breast pains can happen as a symptom, but it will be very way down in the priority. Like what I say is that if there are 100 ladies who have a breast pain without a palpable lump, there's only very rare chance, like 1 or 2% of them only might be having a real cancer inside that. It's more likely something called as a mastitis or a small infection of the breast somewhere, which can be treated readily with an antibiotics or something like that, and it gets cured. But if the pain is not getting cured after one course of antibiotic or one course of analgesic, or if the pain is increasing, if it's spreading elsewhere, it should be investigated, and it can be a sign of cancer. This is associated with, if you remember, I told you about there are so many different types of cancer nowadays. So one type of cancer is something called as inflammatory breast cancer. Inflammatory breast cancer is something that typically looks like an infection. It's painful, it's very red, it's very tender, it's very warm or hot to touch. So that's something that can produce pain also. So pain is usually not a symptom, but if the pain does not disappear after course of antibiotics or painkillers, certainly you should evaluate it.
Thank you, sir. Thank you for patiently helping us through our doubts. Now I think we can move on to our vote of thanks. I would like to invite Ms. Asha Jamin, Project Development Officer, KESS Thrissur, to deliver the vote of thanks.
Thank you, ma'am. I hope I'm audible.
Yes, ma'am.
All right, thank you. It was an honor to have associated with the Department of Home Science, Vimala College, for this very informative session today, being the last day of the Breast Cancer Awareness Month. We are grateful to the principal of Vimala College, Reverend Sister Mabel, or rather Sister Beena, as the audience have been reading off the screen and the webinar notice. Thank you, ma'am, for presiding this event, and more so for this beautiful collaborative effort that we could bring together. We hope to have more associated programs with you in the near future as well. Reverend Father Thomas Varakala, CMI, is the counselor of the Social Apostolate of the Thrissur Devamata province of CMI congregation, and is also the executive director, that is the secretary of Kuriakose Elias Service Society, abbreviated and commonly known as KESS. Thank you, dear Father, for delivering the keynote address and for being available at such a short notice. Father Thomas has been very resourceful in this collaborative event, helping us to link this program with the oncology department and Amla Hospital, where he was vital in medical social work coordination for more than a decade. Which brings us to the speaker himself, Dr. Thrissur, Assistant Professor, Department of Medical Oncology and Hematology, and Head of Clinical Research Unit in Amla Institute of Medical Sciences. Sir, we are much obliged to your acceptance to being our presenter for the day, and that too at such a short notice again. This session was absolutely informative with very clear screen presentations and vital facts, which I'm sure a lot of us were not aware of until now. Thank you, Doctor, for your time and effort, despite the busy schedule you are in. I'd like to thank the Department of Home Science, especially the HOD, Dr. Ruby, and her very dedicated team, Ms. Betty, the convener, and Ms. Urmi, who has been emceeing. Thank you, Team Home Science, in initiating this idea and collaborating with KESS to bring it out most effectively, reaching out to the more than 100 people through this webinar. I take this opportunity to thank KESS for also being a very vital part in bringing this team effort to its pinnacle. We thank its directors, especially Father Thomas Varakala himself, once again, and his priest, Reverend Father Paul Moses and Father Jinta Chureth, for providing all the support to this venture. On behalf of KESS, Department of Home Science, Vimala College, I would like to thank all the audience, without whom this would have been impossible. Reverend priests and sisters, teachers, students, colleagues, families, friends, thank you all so very much for making this event a grand success. Thank you once again.
Thank you, Asha ma'am. Thank you one and all for participating in the session. Thank you, Dr. Thrissur, and thank you all the associates and organizers of the session. Thank you.